Good evening, everyone. Welcome back to my YouTube channel. We are back today for a new topic, the cardiac cycle. That's our new topic today. But before we do that, please, if you enjoy this video, just make sure you subscribe, hit the notification button, so that you are always notified whenever a new video is uploaded. The cardiac cycle represents the sequence of events from the onset of an action potential in the SA node to the generation of a second action potential still in the SA node. Having finished the cardiac impulse or cardiac electric activity, the next part after the action potential has passed, after depolarization, the next part is mechanical contraction. We also saw that part of excitation contraction coupling, where the cardiac muscle actually contracts. We saw all those changes that happens, and now what we are going to see, we are going to see it, that mechanical contraction and relaxation, now as it relates to the cardiac physiology and blood flow. That is a simple introduction about what we are going to do. Again, the cardiac cycle, a short definition. It represents the sequence of events that occurs from onset of cardiac impulse or action potential from the SA node to another action potential. So we have two cycles, or we have the electrical cycle and then the mechanical cycle. Now we are talking about the mechanical cycle. The electrical cycle finished, and now the mechanical cycle is next. But before we look at the real cardiac cycle, it is very, very important to remind ourselves about the very, very simple function of the heart, the simple anatomy and function of the heart. We said that the heart has 4 chambers, and these are the chambers these are the chambers. This is the intraventricular septum, it goes this is the myocardial piece, myocardium. These are pulmonary veins, and then this is the superior vena cava, and then this is the inferior vena cava. So what are the names of the chambers again? This is LA, RA, RV, and then LV. That's what we have. So what we are going to see, there are the functions of the different parts and what we expect as in direction of blood flow. We expect blood to be coming like this and then this is the aorta, this is pulmonary vein, artery, this is the aorta. Blood to come like that, and then to come like that. We expect that. So what is the function of the artery here? Yeah, so functions of the artery. What are the functions of the artery? What are the atria? That is right atrium and the left atrium. What is their functions? They have two functions majorly. They have the conduit function and the pump function. They act as a conduit. What is a conduit? A conduit is just a passage, and then, but at the same time, as pump, because they have to pump some at the end of diastole. They have to pump some blood, so they allow blood to move through them into the LV. But again, at the same time, they have at last they have to pump. They have to do some pumping at the end. So these are the two functions: pump function and then conduit function. Keep that one in mind. Then the LV or ventricles. What are the ventricles? Right ventricle and the left ventricle. They only serve one purpose: pump function. My sick. Pumping only. They are only pumping. Then the next, valves. How many valves do we have? We have AV valves. AV valves. Which are those ones? We have the tricuspid valve and then mitral valve. This is the tricuspid valve, and then this is the mitral valve. And then in other valves, we have semilunar valves. Two of them are there also. We have pulmonic valve and then aortic valve. All these ones, they ensure unidirectional flow of blood. Unidirectional flow of blood. If blood has gone into the RV, it should not go back to RI. If blood moves from RI to RV, then it shouldn't go back. Only this direction is favored. Should be there. And then for pulmonary, if it is leaving RV, it should only go to pulmonary artery. And if it's leaving LV, it should only go to aortic valve. No coming back. If it happens that blood can go back to where it came from, that is regurgitation. Those are regurgitant valves. Those ones we call them regurgitant valves or regurgitation. We don't want that. So the major parts of the cardiac cycle now this one is clear, the functions. So I'll be talking of pump and then pump and blood flow. Again, another thing, what we need to know here, we are talking in cardiac cycle. In cardiac cycle, we are more concerned about pressure changes. in the chambers. Pressure changes in the chambers, that's what we are concerned about. Because the pressure changes, they are going to cause all the events of the cardiac cycle, whether the valve to close or to open. It will be decided by the pressure changes in different chambers. If pressure is more in LA and less compared to LV, then the valve will respond. How will it respond? Either by opening or closing. But for that case, it will be opening. If the pressure in RV is more than that in RA, the valve will respond to that by closing. And then that one, the pulmonary valve will respond by opening. If the pressure in RV is more than that in the pulmonary artery. So pressure changes. Why? Because of pressure changes, blood flow will be determined. Because pressure changes are the ones that determine the direction of blood flow. With pressure changes, we are going to know, okay, if pressure is more in LV than in aorta, then blood will go that side. If it is more in LA than in LV, then blood will go that side. It will go in LV. So pressure changes during the cardiac cycle. I will be talking about pressures. I may not talk about the volume of blood, but I'll be talking about pressures, pressure change, because it drives everything. Another thing to note before we shall see it this side. So the cardiac cycle has two major phases. The cardiac cycle has two major phases. I'm going to shorten it like that to save time. The cardiac cycle, cardiac cycle, CC. I'm going to call it CC. The cardiac cycle has two major phases. One is systole, and then another one is diastole. Two major phases are there, systole and diastole. The atria has their systole, and then the ventricles have their systole. Again, the heart functions, it is a pump, yes, but it has two pumps. The heart is a pump as an organ, it is a single pump, but in essence it has two pumps. The atria, we said, they have pump function, but this pump function, it only pumps or acts as a primer pump. What is a primer pump? A primer pump is the one that prepares the other one. It prepares the ventricular pump to work effectively. Without the primer pumps, the main pump cannot work. So the ventricles are the main pumps. Main pumps. Without the primer pumps, the main pumps will work, but less effective. How will it be less effective? We shall see. Again, the heart, it is a single organ whose major role is to pump blood, but it has two pumps in essence. When you open it closer, when you look at it closer, it has two pumps, the arterial pump and then the ventricular pump. The ventricular pump is the main one, because even if arterial pump is gone, the ventricular pump can still work, and maintain life. But when the ventricular pump is gone, you cannot maintain life. You cannot maintain life. So this is the main pump, ventricular pump. And of them, the most important pump is the left-sided pump. We can divide the heart into this and then this. The right upper and lower, and then left and right. The most important side is the left side. This one is also important, but the most important is the left side. Why? Because the blood from the left side, it goes to the entire body, systemic circulation. This one is important, but not as important as this one. So this one is pulmonic circulation. So this one only takes blood through the pulmonary artery to the lungs to pick oxygen, and then from there blood comes back to the left side through the pulmonary veins, and then it is pumped to the entire body through the aorta. That is systemic circulation. Pulmonic circulation is here, and then it returns back through the venous system, which opens into the right atria as superior vena cava, and then inferior vena cava, and then other opening like coronary sinus. That one is clear. We have seen the two major phases of the cardiac cycle, systole and diastole. These ones, they are the major ones, but in actual sense they are divided, further divided, each into almost 3-3. Almost each into 3-3. And this 3-3, the atria, they have these two. They have their systole and diastole. Also the ventricle, they have the systole and diastole. So from the atria side, the arterial pump has both systole and the diastole. The ventricular side, it also has its systole and the diastole. What is diastole? What is systole? Systole is what we call contraction, and then diastole is what we call relaxation. Systole is contraction, systole is contraction, and then diastole, relaxation. Simple. We just give them new terms here. Yeah. So this is a short introduction. So now let's go deep into the real phases of the cardiac cycle. Yeah, the phases of the cardiac cycle. So the phases of the cardiac cycle, we have already named them, like two of them, major ones, as systole and then diastole. Two phases are there, but they are further divided into, we have said this one is the same as contraction, and then this one is the same as relaxation. We have said that one already. So these ones, they are divided into one, isovolumic, contraction, the next one is rapid ejection phase, and then the third one is slow ejection phase. On the diastolic side, we have isovolumic relaxation, and then rapid feeding phase, and then slow feeding phase. These I'm calling them phases. Now we are dividing these ones because remember I told you primer pumps and the main pump. The primer pump, even if it's lost, it's not that important. It is important, but not all that much important. But the main important thing is the main pump. So these phases are true for main pump. We are going to be focusing on the main pump. Otherwise, how many phases are these ones? These are 6. We can add onto the 7th, which is going to be atrial contraction. So if, let's make it simple, if this, therefore ventricular, these are ventricular phases, then what are the atrial phases? Still on atrial side, we have atrial diastole and the atrial systole. Atrial diastole, atrial relaxation, and the ventricular and the atrial contraction. That's what we said. Atrial relaxation, atrial contraction. Now we are not going to be saying anything about atrial relaxation because the atrial relaxation happens during the cycle of the main pump, and we are more focused on the main pump. So atrial relaxation, we are not going to talk about it, but it is there happening. Whenever you're talking about the ventricular cycle, the atrial cycle is running. Remember, we said in a cardiac action potential, in cardiac action potential, we said impulses originate from SA node located in the atria, and atria get depolarized first. So they pass through their mechanical cycle before the ventricular side. Again, we discussed the function of the AV node, that the main purpose of AV node is to delay the impulse conduction from atria to ventricle. It has to allow that time, which was around 0.9 millisecond or 0.9 seconds, for the ventricles to feel very well. So that delay is for atrial kick. This one is the same as atrial kick. That is a new term. This one, if you don't call it atrial systole, it is the same as atrial kick. You can call it atrial kick. So the AV delay is to allow time for atrial kick. Keep that one in mind again. So in our cardiac cycle, we are going to use this diagrams to illustrate whatever you're interested in, what happens in a particular phase, what is the state of the valves, and what is the pressure changes. That's what we want to know. We are labeling from phase 1 to up to phase around 7, but these are 5, meaning 2 phases are not going to be depicted. Probably that is going to be slow ejection and slow filling. They are not going to be depicted because there is no change, significant change that occurs, so we cannot represent them here. Whatever is happening in slow or in rapid ejection, it is the same. If the valves are open here, they are still open here. We are still in ejection. So we better represent one. Which one is more important? Is rapid ejection. But this one, you may not represent it. Same here. So 2 phases are not going to be depicted. We are only going to show 5 phases. Again, this is the same as what I drew before. So we are starting with phase 1. You can start from any phase as long as you're going to cycle and come back to that phase. So me, I'm choosing to start with like phase 1, atrial kick. I'm choosing to start with atrial kick as my phase 1, atrial system. So what happens in atrial system? In atrial system, the atrial blood is coming already through the pulmonary veins and the superior and inferior vena cava. And this blood, this mitral valve is open. This mitral valve is open. So during atrial kick, 1, atria contract. Atria contract. What happens in contraction? To empty the remaining to 30%, remaining 20 to 30% of blood into ventricles. That is 1. During atrial kick, the atria contract. That is after atrial depolarization. The atria contract to empty the remaining 20 to 30% of blood into the ventricles. Meaning, before atrial kick, 70 to 80% of blood has already entered the ventricles. So, in this one, I'm going to indicate contraction as these inward pulling arrows. These arrows in orange pointing inwards, they're showing contraction. So with the contraction, 20 more blood enters. So the importance of atrial kick is to make sure that the ventricles are 100% full. The purpose of atrial kick is to make sure that the ventricles are 100% full before they start their contraction. Phase 1, it ensures that the ventricles are full before contracting. That's why I told you, the reason why I told you this is not a very, very important pump, the atrial pump. It is because even without atrial contraction, the ventricles already have at least 70% of blood inside them. So they can decide to pump that one, and that one can sustain life. So the 20 to 30%, it is important, but not all that important. Yeah. So what is the state of the valves? We need to say that. So the state of the valves, we are talking about whether atrioventricular valves, we saw them already, that it is, every valve is either mitral valve or tricuspid valve, and then semilunar valves are pulmonic valve or aortic valve. So during atrial kick, the AV, atrioventricular valves, are open, while semilunar are closed. These are the events that occurs. What is the state of the pressure? Pressure in the area, that is, I can write here, or atrial pressure is more than, I'm using this symbol, ventricular pressure, and that's why blood goes to the ventricles. That is phase 1, atrial kick. The next phase is phase 2. Phase 2 is going to be isovolumic contraction. Phase 2 is isovolumic contraction. The video moves a bit, but we shall organize that one within a short time. Yeah, just bear with us. We shall organize ourselves and make sure the video is not moving. Otherwise, listen. The explanation is more important than seeing. For me, I treasure when I listen. And when I listen for the explanation, I can read myself. So here you can see that the mitral valve and tricuspid valves are open, but the opening is not all that too wide. And then these semilunar valves, when a valve is drawn like this is pulmonary artery, and then the valve is drawn like this is open, and then if it is drawn like this is closed. So this is a closed valve. This one is open valve. That's how we indicate them in cardiology, and this is how they close anyway. So closed valve like this, open valve like this. If you see here in this pink, closed, this is aortic valve, pulmonic valve. If you see this, open, this is mitral valve, tricuspid valve. The next is gonna be isovolumic relaxation. Why is it isovolumic? Iso means same volume. Again, first thing, iso means same, no change. So isovolumic relaxation or contraction, meaning there is contraction but with no change in the volume. Which volume? Of the chambers, or you can say directly that there is no change in the volume of blood in the chambers. That is why it is isovolumic contraction. In phase 1, the ventricles received the remaining blood and now they are full. When they become full, the next one is the contraction. At that time, well, by the time they become full, the impulse will have moved through the AV node. So at this instance, still we have blood coming over here. If you see these atria, these are smaller than this. So at this phase 2, isovolumic contraction of the ventricles. Of main pump. Main pump, I mean ventricles. Isovolumic contraction of the main pump. Ventricles. The atria, they are in their diastole. Diastole, I'm indicating it with outwardly pointing arrows. Relaxation or feeding, it is indicated by outwardly pulling arrows. So blood is continuously flowing into the atria. Yeah. So the atria are feeding. Feeding. They contracted and all their blood into LV. Now they are feeding in phase 2. What is happening in LV? The ventricles, not LV, the ventricles, both of them, are contracting isovolumically. With no change in volume. Why is it isovolumic? Because all valves are closed. All valves are closed. The pressure in the ventricles, we have to say that the pressure is more than that in atria. Why is it more than that in the atria? How do we tell? Because the atrioventricular valves are closed. Whenever the valve closes, there is a pressure difference. So here they are low pressure now. So the valve, the ventricles are contracting and they appear larger compared to this one. Blood will tend to try to move back to atria. It will try, but because some blood is acting from here, another one is acting from here, so it will force these leaflets, we call them leaflets or cusps, to come together, and since they are having papillary muscles, we have papillary muscles that they are supporting these valves, they cannot prolapse into the atria. They can't. We have papillary muscle this side, papillary muscle the other side. They can't prolapse into the atria, no. They just remain taut here. And see, if they are functioning very well, we won't have blood passing through here and back, unless the valve is damaged or is not working well. Some pathology is there. So that is what happens at the level of atrioventricular valves. Now, what happens at the level of semilunar valves? The semilunar valves, that is aortic valve and the pulmonic valve, they are still closed. Why? Because the aortic pressure and the pulmonary artery pressure are still more than the pressure in the ventricles. The aortic pressure and the pulmonary artery pressure are higher than that in the ventricles. We are writing the aortic and the pulmonary artery. This is how I'm writing it. Aortic and the pulmonary artery pressure are more than that in the ventricles. So since it's more, that's what keeps these valves closed. They cannot open when the pressure here is low. And if they are working very well, if the pressure here is much, some blood will tend to come back. But if it can close properly, then blood cannot go back and they cannot prolapse into the ventricles because we have a ridge here. Yeah. That is phase 2. Phase 3. In phase 3, now the pressures are going to change and this is not isovolumic. In phase 2, we are contracting but with no ejection because all valves were closed. Now in phase 3, we have contraction but with ejection. So same thing is still happening here. The atria, they are still in diastole. The atria are still in diastole and the blood is still coming. Now here, yes, here I'm indicating the ventricles are contracting with these arrows. Same here. They are contracting. And what is different is pulmonary valve is still their semilunar valves are open but atrioventricular valves closed. This one is phase 3. Phase 3 is rapid ejection. Why is it rapid? Because the moment you open the door, it's like when you are locked in a room, when you are many there fully packed. When the door is open, the people who will be near the door will be pushed and run very fast outside. And these ones will be behind, they will be walking slowly. So same. The door has been closed here, but now here the door is going to be open and the blood which is around here to run very fast to move out of this chamber, closed chamber. So it's escaping. So what happens here in phase 3? Semilunar valves open. AV valves still closed. What about the state of the pressure? Ventricular pressure is more than pressure in great arteries. What are great arteries? Great arteries are pulmonary artery and the aorta. So these are great arteries. When I say great arteries, I mean it is same as aorta and the pulmonary artery. Those are great arteries. So the pressure in the ventricle is more than that in great arteries. And now blood is moving ventricles to great arteries. Meanwhile, atria still in diastole. Clear? So this is what happens in phase 3. We started from here, phase 1, phase 2, phase 3. The next is phase 4. Phase 4 is going to be isovolumic. Phase 4 is going to be slow ejection. Phase 4 slow ejection. But what is happening? What happens in phase 4? All that happens in phase 3 is still happening in phase 4. And meanwhile, all these ones, they are still happening in phase 4, as the way the arrow indicates. All these ones are still the same in phase 4. It is slow ejection. We are still in ejection. Now this drawing is for phase 5. This one is for phase 5. Phase 5, we are going to isovolumic relaxation. After slow ejection, the next part is the relaxation. After ejection, next part is the relaxation. And we start with isovolumic relaxation. We said isovolumic means same. And what is same? Same volume. Well, that's what it is. That's why it is isovolumic, same volume relaxation. Isovolumic relaxation, blood is still flowing here through the arteries coming into and veins coming to the atria. When you see these ventricles, they are larger than these ones. Here they have finished their systolic function, and now at the end of systole they look smaller compared to how they were looking in diastole. If you see here at isovolumic contraction, these ones are larger than this one, because here no blood has gone out, but here some blood has gone out, so they appear. The more blood that leaves, the smaller it becomes. So here the atria, they are still in their relaxation phase, but in the last parts it is almost full. Almost full. Phase 5 is the isovolumic relaxation. In isovolumic relaxation, what happens? Isovolumic, still all valves are closed. All valves are closed. So what is happening? The pressure in ventricles, why did the semilunar valves close, is less than that in arteries. Why did the valves close? Because the pressure in the arteries, that is aorta and pulmonary artery, became more than that one in the ventricle, which forced the aortic valve and pulmonary valves to close. And when they close, no more ejection. Simple. But the ventricular is still more than that in the atria. Ventricular pressure is still more than that in the atria, and that is why the mitral valve and tricuspid valve cannot open. They are still closed. If ventricular pressure is more than that one in the atria, then the atrioventricular valves, they are closed. So here they are still closed because the pressures in the ventricle are still more than that in the atria. So no net blood flow happens. Atria still in diastole. They are still feeding. The atria, they are still feeding. So this is phase 5. This is phase 1, phase 2, phase 3, phase 4, phase 5. Now next one is 6. So this is relaxation. We have to draw arrows going outside to be consistent. So next is phase 5, phase 6. Phase 6 is for rapid feeding. Phase 6 is for rapid feeding. What happens? Now here the atria, they are working as these ones. They do their conduit function. Blood just passes, so blood here just comes. Here blood was moving. Here no blood flow, but here blood was moving in this direction. And if you see these valves, we said an open valve appear like this. So when you are drawing, if you are answering a question, you have to answer something like this. Here, closed valve. here widely open valves, widely open mitral valve, widely open tricuspid valve, and the blood is just passing. So these ones are relaxing. They are getting bigger. And then, okay, we can write 5, 6, phase 6, that is rapid feeding. In rapid feeding, we have AV valves open, ventricular pressure fall below, that in atria. Ventricular pressure fall below that in the atria. What is the response? Aortic valves, mitral and tricuspid valves open. What is the next? Blood flows into ventricles. How much amount? That is 70 to 80% of blood enter the ventricles during the rapid feeding phase. 70 to 80% of blood. Then semi-lunar valves are closed. Simple. That is what happening. That's what happening during rapid feeding. Then stage 7 is it slow feeding, or diastasis. This is another word for slow feeding, diastasis phase. What happens? All in phase 6 apply in phase 7. Whatever happens in phase 6 still applies in phase 7. And then next we go back to atrial kick after slow feeding, and then atrial kick. So this is a cycle. The cycle rotates like that. This arrow from 1 to 2, 2 to 3, 3 to 4, and then 4 to 5, 4 to 5, and then 5 to 6, and then 6 to 7, and then 7 to 1. That is a cardiac cycle. Very simple. Exam come, you write this, you have all the 10 marks.